Did you know that combining certain medications can lead to life-threatening and irreversible risks? Many of us take various medications daily, but are we truly aware of the dangers posed by incorrect combinations? In this video, we'll explore some of the most common dangerous drug interactions that you might be unaware of. If you want to know which medications should never be taken together and why, stay with us until the end of this video. 1. Warfarin. Warfarin is one of the most commonly used anticoagulant medications, prescribed to prevent strokes, pulmonary embolism, and deep vein thrombosis. It works by reducing the blood's ability to clot, thereby helping to avoid life-threatening conditions. However, its use must be carefully monitored, as improper dosing may lead either to dangerous internal bleeding or the formation of harmful clots. One of the major challenges with warfarin is its interaction with foods and other medications. Foods high in vitamin K, such as spinach and cabbage, can reduce its effectiveness, while drugs like antibiotics and aspirin may enhance its effect. For this reason, patients are required to undergo regular blood testing, INR, to ensure their blood's clotting level remains within a safe range. In conclusion, although warfarin can be a life-saving drug, it demands continuous monitoring, accurate dosing, and full cooperation with medical professionals. 2. Insulin. Insulin is a vital hormone produced by the pancreas that plays a central role in regulating blood sugar levels. People with type 1 diabetes and some with advanced type 2 diabetes require insulin injections to keep their blood glucose within a healthy range. Despite its life-saving benefits, improper use of insulin can be extremely dangerous. One of the most serious complications is hypoglycemia, which can lead to sweating, dizziness, seizures, coma, or even death. The risk increases when insulin is used with irregular meals, excessive physical activity, or in combination with other medications. For safe use, insulin therapy requires thorough education, regular blood sugar monitoring, consistent meals, and strict adherence to the prescribed dosage. While insulin is essential for managing diabetes, misuse or mismanagement can pose serious threats to a patient's health and life. 3. Clozapine. Clozapine is a powerful antipsychotic medication typically prescribed to patients with treatment-resistant schizophrenia, those who have not responded to other antipsychotic drugs. It helps reduce hallucinations, delusions, and disorganized behavior, significantly improving the quality of life for many affected individuals. However, clozapine is considered one of the riskiest medications in psychiatry. Its most severe side effect is agranulocytosis, a drastic reduction in white blood cells, which makes the body highly vulnerable to life-threatening infections. For this reason, patients must undergo regular blood tests to monitor their white cell count closely. Clozapine may also cause significant drowsiness, weight gain, seizures, or cardiac complications. 4. Paracetamol. Paracetamol, also known as acetaminophen, is one of the most widely used over-the-counter medications worldwide. It is commonly taken to relieve mild to moderate pain and reduce fever, and it is an ingredient in many cold and flu remedies. While generally safe at recommended doses, an overdose of paracetamol, or its use alongside other medications containing the same ingredient, can lead to severe liver damage. This damage may remain asymptomatic for several days before resulting in liver failure or even death, and in some cases, a liver transplant may be required. The risk is significantly higher when paracetamol is combined with alcohol or used by individuals with pre-existing liver conditions. 5. Aspirin. Aspirin is one of the oldest and most commonly used anti-inflammatory and antiplatelet medications. It is taken to relieve pain, reduce fever and inflammation, and in low doses, to prevent heart attacks and strokes. By inhibiting platelet function, aspirin helps prevent blood clots, making it especially valuable for patients with cardiovascular disease. Despite its benefits, aspirin carries notable risks. Its most serious side effect is gastrointestinal bleeding, especially in individuals with a history of stomach ulcers or those using it long-term. The risk increases when combined with anticoagulants or alcohol. In children, aspirin use has been linked to Reye syndrome, a rare but potentially fatal condition affecting the brain and liver. Now, let's move on to the next section, which focuses on dangerous drug interactions that could potentially lead to fatal outcomes. Fourth is the most important one. 1. Aspirin and anticoagulant medications. Combining aspirin with anticoagulant medications such as warfarin, rivaroxaban, or dabigatran can significantly increase the risk of internal or external bleeding. Aspirin, due to its blood-thinning properties, can amplify the effects of these anticoagulants, making bleeding more likely. This combination is especially dangerous for patients with a history of gastrointestinal issues or bleeding disorders. Severe complications, such as gastric or cerebral hemorrhages, are serious risks when these drugs are used together. Additionally, the interaction between aspirin and anticoagulants can lead to hypotension, prolonged bleeding episodes, and even organ failure in extreme cases. 2. Tricyclic antidepressants and alcohol. Combining tricyclic antidepressants, such as amitriptyline and desipramine, with alcohol can lead to serious health risks. These medications already have significant effects on the nervous system, potentially causing drowsiness, dizziness, and impaired concentration. When taken alongside alcohol, which also depresses the nervous system, the effects of these drugs can be amplified, leading to extreme drowsiness, confusion, and reduced decision-making ability. Additionally, this combination increases the risk of cardiovascular issues, such as irregular heartbeats, low blood pressure, or even cardiac arrest. In some cases, it may also lead to respiratory problems or drug overdose. 3. SSRIs and NSAIDs. Combining SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, citalopram, and sertraline, with nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen can significantly increase the risk of bleeding, especially in the gastrointestinal tract. SSRIs affect the serotonergic system and can reduce platelet aggregation, increasing the likelihood of bleeding episodes. When SSRIs are taken alongside NSAIDs, the risk is heightened. NSAIDs work by inhibiting the COX-1 enzyme, which not only provides anti-inflammatory and analgesic effects but also contributes to an increased risk of gastrointestinal bleeding or ulcers. This dangerous combination can result in conditions such as stomach ulcers, gastrointestinal bleeding, or even cerebral hemorrhages. 4. Opioid painkillers and benzodiazepines. Combining opioid painkillers such as morphine, codeine, and hydrocodone with benzodiazepines like diazepam, lorazepam, and alprazolam can pose serious risks to the respiratory system. Both classes of medications independently depress the central nervous system and reduce brain activity. When taken together, they can severely suppress breathing, cause a sharp drop in blood pressure, and even lead to cardiac arrest. This combination increases the likelihood of extreme drowsiness, confusion, and impaired alertness, which can elevate the risk of accidents and physical harm. Additionally, at higher doses, the risk of drug overdose and toxicity becomes significantly greater. Due to these serious risks, the concurrent use of these drugs must always be carefully monitored by a healthcare provider, and it is recommended that this combination be used only when absolutely necessary. We hope this video has been informative and provided you with essential knowledge to avoid dangerous drug interactions. If you have any questions or experiences to share, feel free to leave a comment below. Don't forget to like the video and subscribe to our channel for more content.